Hey everyone, today I want to talk about antipsychotic medications. These medications are used to treat a variety of things, a variety of mental health conditions that affect how people think, feel, and behave. Mainly used to treat schizophrenia, bipolar disorder, as an add-on medication for depression, and to treat severe mood swings or confusion. There are two main types of antipsychotic medications. Older medications, also called first generation or typical antipsychotics, and there are newer medications, also called the second generation or atypical antipsychotics. The older antipsychotic typical medications include haloperidol, which is Haldol, chlorpromazine, which is Thorazine, and fluphenazine, which is Prolixin. Those are just the most common ones. They're used to treat serious mental health conditions like schizophrenia or severe mood episodes. No medication is without side effects, and antipsychotics tend to have more serious side effects than other medications. For this group, some of the side effects are muscle stiffness or shaking, restlessness, feeling sleepy, and even dizziness when standing. It's important to watch out for any unusual muscle movements, and doctors will use an AIMS checklist when they meet with their patients to ask about different potential movement problems. And I will talk about those movement problems in another video. The newer antipsychotics, the atypicals, include most commonly risperidone, also known as risperidol. There's olanzapine, which is Zyprexa, quetiapine, which is Seroquel, aripiprazole, which is Abilify, and clozapine, which is also known as Clozaril. These are used to treat schizophrenia, bipolar disorder, depression with other medications, and mood or behavior problems in autism. And these are often preferred because they have fewer of those movement-related side effects than the older typical antipsychotic medications. And I'm going to go through each of these medications one by one because each medication has some particular things about them. So I'm going to start with risperidone. It helps with schizophrenia, bipolar disorder, and mood problems in children with autism. Some side effects from this medication include weight gain, hormone changes in females can affect their periods or cause breast changes, and at higher doses may cause muscle stiffness. So providers are going to be monitoring for weight gain. They'll do weight checks. They may do blood tests for hormone levels if it's needed. And of course, they're watching for those movement side effects. Olanzapine helps with schizophrenia and bipolar disorder. This medication can cause significant weight gain. It can raise the blood sugar levels and cholesterol levels, and it can cause drowsiness. So providers are going to be monitoring the blood sugars and the blood cholesterol levels, and they're going to monitor their weight and blood pressure. Quetiapine helps with schizophrenia, bipolar disorder, and depression when other medications just aren't quite enough. It can cause some sleepiness, it can cause weight gain, and lightheadedness. Providers are monitoring for weight gain, so they're doing weight checks and they're doing blood pressure and blood tests. Aripiprazole helps with schizophrenia, bipolar disorder, depression, and Tourette syndrome. Some side effects of this are restlessness or feeling jittery, trouble sleeping, and it's less likely to cause weight gain than some of its other counterparts. Doctors and providers are going to be monitoring for restlessness or sleep issues, and they're going to be doing some weight checks. Clozapine is used for, in special cases, mostly for treatment-resistant schizophrenia. It really helps when other medications don't work, and it also helps with suicidal thoughts. The side effects from Clozaril can lower your white blood cells, which could lead you at greater risk for infections. It can cause seizures, but it is very rare. It does cause weight gain, it can cause drooling and constipation. There will be regular blood tests weekly at first and then less often, checking those white blood cell levels. And we're going to be watching for signs of infection like a fever. And we're going to be monitoring weight and blood sugar. And as a general rule, all the providers are going to be monitoring anybody on antipsychotics for weight gain, for elevated blood sugars and cholesterol, their blood pressure, and movement side effects like shaking or even restlessness or stiff muscles. And with clozapine, there will be additional blood tests to monitor those white blood cell counts. So the key things for what to know about antipsychotics is they're important for treating serious mental health conditions. They can help with thinking clearly, help with mood, and help with behavior. And each medicine has its own benefits and side effects. Regular checkups and blood tests help keep people on these medications stay safe and prevent other medical complications like diabetes. And if you have any other questions, let me know.